Today on the Transplant Helper, surviving emergency room visits. Are there ways to make it better, safer, and even easier to visit your local emergency room? Stay tuned and I'll tell you if that's possible. Hey folks, I appreciate you joining me again today on the Transplant Helper podcast and YouTube video series. My name is Jim Merle, and again today's topic of discussion is basically how to survive the emergency room. Now you know as well as I do that as transplant patients, typically speaking, I like to, and perhaps you do, we like to avoid going to the emergency room at all costs. Now, certainly that may be for one reason that we don't like to be in life-threatening situations, but for another, we realize that the emergency room sometimes seems to be a pool for infections and bacteria and germs and all sorts of things that you and I as transplant patients do not need to be associated with. We're immunosuppressed. Our bodies are not going to be able to fight off even the most common colds, diseases, and such, and we don't want to be in those environments. So because of that, we don't like to go to the emergency room. Now, today's question comes up in my mind, and the way I'm going to deal with it because of a Facebook post I read just a few days ago. I'm going to read you a portion of that post right now and let you consider this with me, and then we're going to come back and talk about some things underneath this heading. Here's what this person posted on a heart transplant support group that I'm a member of. Here's what she asked or stated. Do you think that we should have a special place to go when we get sick instead of the ER? And I mean minor issues such as sore throats, ear infections, possible flu, viral breakouts, and such. Primary care facilities typically get stumped and very nervous with transplants. What is your experience and how do you feel about it? For me, going to the ER is getting old and not the place for us. I just wish we had a better option. Now, I commented back on this Facebook post immediately and basically said, I agree 1,000%. 1,000% I agree with that. The ER is not the place for us. However, again, in certain situations, obviously life-threatening situations, which by the way is the real purpose for an ER, emergency room, that's exactly where we need to be. And there's no doubt in my mind, if I've got to put myself in jeopardy of maybe catching a cold or catching the flu or something versus, if I'm having a heart attack or maybe you're, in some kind of pulmonary distress as a lung patient or kidney failure, having other problems, I'm going to the ER, no doubt about it. And you would totally agree with that. However, we don't really want to be in there. We know it's a dangerous place. We know it's somewhere where we need not be. So we go there for life-threatening illnesses. But at the same time, if you're like I am, you have been referred to that ER, the emergency room on occasion, by your transplant doctors and for non-life-threatening things such as were listed here, colds, flus, viruses, that sort of thing. We've been referred there before. And for me, and I'm only speaking of me, I'm associated with UAB Hospital in Birmingham, Alabama. It's a wonderful transplant team. I'm not trying to measure it against yours, say mine's better or yours is worse, but mine's great. As far as if it's during clinic hours, without question, I give my coordinator a call. Her immediate response is always, come in the clinic right now. No hesitation, no sending me off to the local ER, no sending me out to a primary care physician. They care for all my needs right there in the clinic. I'm asked to come in right then, no appointment necessary, if you will. And I oftentimes do that. On top of that, once I get to clinic, if they see that it's going to be something more serious than, say, just writing a prescription or giving me an IV drip, they're going to turn around and have me admitted to the hospital, sure enough. And oftentimes that's by bypassing the emergency room. That is, I never go to the emergency room. I go from clinic up to my hospital room, which is usually on HTIC or heart transplant intensive care, which is just where they keep all of us transplant patients, hearts at least, as they can. So if those rooms are available, we go straight up. But if it's the case that it's after hours, or if it's the case that it is, life-threatening, or it's just that they see fit, okay, the emergency room is the best place. Maybe we can get the most available testing or the quickest testing done here, the appropriate testing done here, or see a certain other kind of specialist. They may very well send me there, and they have done that on occasion. And again, when I do that, and if they do that, I get VIP treatment. That is, at UAB, you go in, you tell them you're a heart transplant patient of 2013 like I am. They probably already called ahead. You walk straight through, bypass the crowds, bypass the wait time. You're put in the back, kind of off to yourself, and you're protected from that. And then those doctors and nurses are there ready on call, helping you out. That's what I've experienced. Now, if yours has been different, I apologize, but that's what I've experienced. Now, with that said, I understand not everyone's going to experience that. So what are we going to do if we have to go to the ER? Say, as I say sometimes, heaven forbid it not be our transplant ER. What are we going to do? Well, there are a couple of things I want to mention today. Number one, I want to talk about the precautions, and they're the most obvious things there are. That is, if you were to have to go to the ER, by the way, if you're going to the primary care physician or if you're going in clinic on a day when you yourself are sick or maybe someone else there is, I mean by that other than just related to your organ, mask up, glove up. No doubt about it, mask up and glove up. Try to protect yourself as well as protect others, and there's no argument about that. You know, I go into the ER, if I wasn't able to bring a mask, which I generally have some, I got one laying right here on my desk. It's just a little cheap kind. I even cut grass in this one, but, you know, I'm going to put a mask on. I'm going to wear that over there, going to wear it while I'm there, throw it away as I'm leaving, that sort of thing. But if not, I'm going straight to that front desk or asking a family member to go to the front desk. Maybe I hadn't even made it in the door yet. Get me a mask. So mask up, glove up, protect yourself. That's the precautions. And other than that, there's not a whole lot you can do. I've even found myself before sitting in a corner almost not wanting to breathe, you know, afraid, but, you know, mask up, glove up, about all you can do. But what about the procedures? What about the procedures? Again, my transplant center is already, I give them an A+ on this, but if you need help with this, I think this will help you. This is the pattern by which I follow, and I remember each time I have to go in to any place, even my own transplant center, keep this in mind. I'm going to divide it in 3 parts. They'll all sound similar for your memory. Here's number 1. First of all, speak ahead. Number 1, speak ahead. And what I mean by that is, go ahead right now, while you're not sick, while you're healthy, while you're doing the best that you can. When you speak to your transplant doctors, to your coordinators, to the nurses, whoever's there in your care facility, have a talk with them right now and say, what is your protocol? What would you do if I called you tomorrow and said, I think I've got the flu. I've come down with a fever. I've got these symptoms. What would you do about it? Ask them, what would you do as far as, you know, how would you deal with me if you suggested I go to the ER? What precautions would you suggest? Just sit down and speak ahead, talk, have that sit down talk, have that discussion. I mentioned this on previous programs also about basically having a relationship with your transplant team, with your physicians, and that how much of that improves our care. And I'll try to link that up here in the video right now, as well as maybe even in a minute link the same video about fighting infection, which I failed to do, but it'll be up here or down below nonetheless. But anyway, speak ahead. That is up right now, ahead of time. Talk to them, sit down with them and say, hey, what's your procedure? What's protocol? How can I deal with this? Number 2, very simply, call ahead. Call ahead. And this is a biggie in my book, because on the rare occasion when I've had to call my transplant center and either it's after hours or maybe the symptoms were such that they made the judgment, hey, he probably should go into our ER rather than coming into clinic, I always call ahead and let my coordinator know, hey, I'm on the way to UAB Hospital, but I'm not coming to clinic. I'm coming to the emergency room, and here's why. Or let's make that choice together. Here's why I should go. And if they deem that to be the case, I've already called ahead, because what they're going to do as a favor to me, and I'm so thankful for it, at least my hospital does, they're going to call ahead for me. That is, they're going to contact the emergency room before I even get there, which for us is about an hour drive. They're going to call ahead and say, hey, Jim Merle, heart transplant patient 2013, who's immunosuppressed, is coming into this ER here within an hour, and you need to be prepared, and he doesn't need to wait. He doesn't need to be left out in the population with the general public. He needs to be moved somewhere else where he's kind of quarantined off, kept away from potential infection and disease. And they're always, again, great about calling, but it's up to me to call ahead first. It won't do any good if I show up on the emergency room doorstep, and I've not already notified my transplant team that I'm coming, because they can't do their part that they already have agreed to do, which is for them to call ahead too. So speak ahead, have that conversation with them, find out what their protocol is, but then call ahead so they can do what they need to do. And then thirdly here, and this is the last one here, shorter program, the last one, go ahead. And I mean by that, go ahead and be proactive. Back as I mentioned earlier, mask up, glove up. When you get to the ER, have no shame in your game, as we say. You march your little self right up to that front desk, to the receptionist, whoever's checking you in. If you're stopped, even as I've been before, we have to go through, in that emergency room at least, we have to go through a guard and through a metal detector. I'll stop right there and say, hey, I need mask, I need gloves, and by the way, I'm a transplant patient. I'm immunosuppressed. I cannot sit out here. Now, you may not see me first in line because my symptoms may be less severe than the person over here who's having a stroke, or the person over here who's had a heart attack. And by the way, I hope they came in by ambulance, but nonetheless, you don't have to put me as priority over everyone as far as when I'm seen, but I can't be here. I can't sit here with them. I can't sit next to the guy who's throwing up in the barf bag. I can't sit next to the lady who's coughing a lung up, and I'm not meaning anything ugly by that, but, you know, I'll sit there and pray for them across the room or down the hall, but I can't be there with them. So I'm going to go ahead, and that is I'm going ahead to that desk, and I'm going to let them know I'm a transplant patient, I'm immunosuppressed, and I need to be put somewhere where I'm safe. And if you're not willing to stand up for yourself, then what treatment are we to expect? Now, what if you're denied in that? Hey, I can't say that I've ever been I could say denied, but I did make it to the desk on one time, and I was just, I was like fourth in line. And what I did that day, because I couldn't get up right quick and let them know what I needed, I let the person who drove me over there, which I think at the time was my daddy, I let him stand in line, and I walked back over there, and I stood right by the front door and finally sat right by the front door. That is where the doors were opening and closing, and the fresh air was coming in the emergency room. I sat right there and kind of breathed toward the door, just to be cautious, while he let them know who I was. And then finally, I'll admit, I got some priority. Name was checked up, taken right into triage, taken right to the back. But I'm not sure this will always work for you, but I'll tell you this, it'll work better than you doing nothing. So speak ahead, call ahead, and go ahead. It may save your life. Now, this is just my tips for visiting the emergency room and trying to survive it. What are your tips? What do you do if you have to go to the emergency room? I know you avoid it like I do, but what if you had to go, say, tomorrow, heaven forbid? What would you do? I'd like to hear from you from the comments below. Now, let me ask you this. If you've not already liked, subscribed, or share this channel, do it right now. I'd love to have you subscribe so I can continue to provide you with content that both advocates, educates, and hopefully even motivates you as a transplant patient. Until next time, stay stronger, friends.